Hello, YouTube. This is Kevin. I am uniquely qualified to help you with some of the struggles you might be having with your body. Today, we're going to look at something a little bit more specific. We're going to be looking at the neck, the face, the head, maybe even a little bit of shoulders, and some of the things that affect your breathing and posture and overall function. Number one, I have had problems since I was 15 years old. I've had countless bouts of neck and back acute pain where you get locked up, you can't move, you feel worthless, you can't even look to the side or breathe or cough without experiencing horrendous pain. A little bit about me: I am a Gen X guy who's enjoyed martial arts, snowboarding, skateboarding, freestyle BMX, climbing, wakeboarding, parkour, calisthenics, natural bodybuilding. I am a yoga guy. I'm a doctor of physical therapy with over 24 years of experience. I've specialized in orthopedic manual physical therapy, balance and vestibular issues. I am a survivor of a 3-level cervical fusion. You can see a couple of my incisions right here, and a multi-level low back fusion as well, all within the last year and a half. So you can come out the other side with this and feel a whole lot better. My goal is to age uncommonly well and to help you move younger and better despite your circumstances. So let me narrow it down a little bit. Let's start looking at the neck. So the first thing that we're going to do, again, some of my favorites. There are so many different ways that you can attack this animal. Quick disclaimer that this is not necessarily medical advice. While I am a physical therapist, I am not your physical therapist. So if you have any questions about any of this, please ask your doctor, treating provider, if some of these things are okay for you to do, especially if you have concerns. So moving forward, what we're going to start by doing is we're going to look at a couple of the muscles that can become really problematic, and how we can first reset our body is to begin with making our posture right. So sit in front of the screen and then just start to relax. I'm going to have you just take the tongue and put it to the roof of your mouth, just the tip of the tongue, very close to the front of the teeth. And what that's going to do is it's going to take your jaw just apart, just a tiny little bit, just enough for saliva to get between it. That's going to be your resting position. A lot of times we clench our jaw and we stay real tight. So go ahead, the tongue on the roof of the mouth. And from there, go ahead and take your shoulders, bring them back just slightly. And then imagine a string is pulling your head straight upwards. So you get that upright posture. Your chin's going to tuck in naturally, and that is going to be your resting position. Adjust your hips if you need to. Get them underneath you. I don't want you sitting, slouching in this position. So just get up in a nice upright position. From here, we're going to begin with starting to decompress some of the problematic muscles that we have. Let's look at the upper trapezius muscles. So those are the ones that hike our shoulders up, okay? So what I'm going to have you do is just hike them up, keep your hands relaxed, and let them come down. Hike them up and come down. If you want to go ahead and breathe with this, as your shoulders come up, take an easy breath of air in, and fill up your abdomen, fill up your belly when you're breathing in. And if you get that far where you're breathing in with your belly, as far as you can breathe in, then start letting that breath move up into the chest so you expand just like a cylinder, okay, from the bottom up. Breathe in, belly is protruding, bring that up into the chest, and then just simply let it go. Okay, so each movement as you come in and out, up and out. Now what I also like to do is I like to do some individual shoulder shrugs. It's good to be able to move body parts independent of each other. So just bring one shoulder up, one shoulder down. And sometimes, if you like to coordinate, as one comes up, you can press the other one down lower. Press one down and pull one up. Good. Okay. From there, we're going to look at getting to our upper traps a little bit more closely. We're going to assist ourselves by taking our hand and pull on the elbow a little bit so you can reach to the back of that upper trap. And all you're going to do is you're going to hook down a little bit with your fingertips, and then you're going to just let your arm fall and rake down the upper trap muscle. As soon as you run out of muscle, you can reset it. Rake it on down. Getting some blood flowing in some of those areas that get really congested. And that's not blood flow, that's blood pooling. When a muscle is just really contracted all day long, you don't necessarily have good circulation. You have stuff that just kind of gets stuck in areas, and that creates some discomfort a lot of times. Good, let's switch sides. Again, pull that elbow up. I'm trying not to rub into this mic here and make a lot of noise. And then just let that tips of your fingers, just rake across those muscles just a little bit and be really nice to yourself. Um, this is a sensitive area, and sometimes you don't realize you've done too much until it's already done. Good. From there, we're going to move up into some of the major muscles of tension here, temporalis muscles. So bring your fingertips just gently up above the ears, and to check where you're at, just above the ear and just behind the ear, this fan-shaped muscle that assists you in closing your jaw. So if you just kind of clench your teeth together, you'll feel that push against your fingertips. Take that area and just do some easy massaging circles up into that temporalis muscle. Just repeat that movement, nice and easy. Even reverse the direction a little bit. Good. From there, we're going to scoot on down to the top of the jaw. The masseter muscle also helps in clenching your jaw. And you're going to start with some small circles in this fashion. Small circles on that muscle. Are you on the right muscle? Clench your teeth a little bit. You'll feel it pop out. That's your masseter muscle. Stay relaxed. Nice and easy circles. Good. From there, we're going to take your thumbs, okay, that border there, and you're going to wrap around by the front of your chin, okay, and that's where you're going to start raking across the inside of your jawline, the inside of your mandible. Start at the chin and let that long thumb just rake through that area just behind the jaw. And keep the teeth just gently apart. And this is very gentle because you have a lot of very important structures in here. You got a lot of lymphatic tissue, you got some parotid, a lot of stuff that you don't necessarily need to be beating up on that much. It can cause more harm than good sometimes. Good. From there, we're going to come down to right along either side of the trachea. And from there, we're just simply going to take that tissue and draw it on down. Just a gentle pull of that area down towards the chest, just alongside. Now, with any of these things, these are just ideas. Not every technique is right for everybody, and it's best to have a professional guide you through this, somebody that knows your specific condition and what things trigger or alleviate your pain. Good. Excellent. Now we're going to introduce a little bit of movement into the head and neck. So for this one, we're going to take that grip where we came around. If you can pull it across far enough, you can reach the center of your vertebrae, the little bumps going on down your neck. And when you find those, what you're going to do is you're just going to pull to the inside till you just drop off the edge. And as you turn your head to the side, you're going to pull your hand. I like to assist my elbow in bringing it back, turn your head, and rake across. So you are moving with your own muscle, but you're giving a little extra to that movement. Now what I'm doing, if you're noticing, I'm moving up slowly, thinking about doing just one vertebra by one vertebra, and then coming back down. So you're probably reaching the span of 6 to 8 inches, just coaxing those vertebrae to turn. Let's go ahead and repeat that for the other side. I'm going to pull my hand across, try not to bump into my mic. I'm going to start off low, and as I turn my head, I'm going to go ahead and rake across that area and just gently coax those tissues to come along with. Very gentle. I am not using a lot of pressure. You can use the same hand, same side, but I just think it feels awkward for me. So just do the way that suits you best. There's a lot of different ways to adapt things. And I'm going to walk that back down, grabbing a little further down. Perfect. Okay. All right, from here, now we're going to begin to move our neck in some different directions, one of which are going to be figure eight. So this is going to take the joints through a lot of different ranges of motion. So start with doing that range of motion with your eyes as well. So your eyes have muscles in it that control your eye movements. There are reflexes attached to your eyes. This is going to mobilize all of the structures, including the fascia, the nerves, the bones, the joints. So begin by tracing really an infinity loop or a figure eight, just like this. You're going to do that first with your head, and then you're also going to look past with your eyes as well. Your neck can only move so far, but your eyes can go a little bit further. So just try to take your eyes a little bit further, and your neck will go. Now, of course, you may hear a lot of noise in there, and that noise is usually something you can hear a lot better than anybody else. Everything is connected in your head and neck. And there's a lot of fluid between all of those structures, so it communicates sound really easy. As long as you don't feel significant pain or anything that worries you too terribly, that is okay. Good. Let's reverse the direction. Again, tracing those figure eights and taking the eyes a little bit further than your head can go. And keep that movement very slow, very deliberate and controlled. We can get into trouble moving too fast, especially with an injured neck or a degenerative neck. It doesn't like to move the same way. It doesn't like to move as confidently as an uninjured area that doesn't have degenerative process, that doesn't have instability, that doesn't have tightness. It affects everything. Good. Center back up again. All right, get your bearings. From here, we're going to exercise a couple of the muscles of the eyes and incorporate some head turns. So what we're going to do is we're first going to keep our eyes looking straight forward, and from there we're going to turn our head from side to side, trying to keep a view on one fixed point in front of you. Every once in a while you might mess up and look in the wrong direction, but try to keep your eyes focused straight forward. There may be something on the wall in front of you. Good. Let's center up. Now let's do the same thing with gentle up and down movement. Up and down. Don't utilize the extremes of your range of motion. We're in a comfortable, happy place here. Excellent. Now what we're going to do is we're going to incorporate a little bit of turning, but we're going to focus on something directly to our side. Okay, so I'm going to be looking with my eyes. I see a light switch that's pretty much directly out from me. So I'm going to keep my eyes there. I'm going to turn my head to the front, and I'm going to try to keep that light switch in my field of vision, at least my periphery. Hard to do. Take it nice and easy. It's okay to mess it up. I like to do between 5 and 10 repetitions. Let's go ahead and do that to the other side. I'm going to find something on this wall. I see a picture of my beautiful daughter there, so I'm going to focus on that. And now I turn my head forward. Oh, see, I messed up. Head forward. Keep that picture in my periphery. Keep my head on the picture. Take your time and be patient with yourself. Any new activities are new activities. You'll learn fast. Excellent. Bring your head straight forward. Okay, some of the problem muscles, the scalene muscles, that come in deep through the neck and then attach onto a lot of the structures in front of the ribs. So this one's very simple. Place your hand down on top of the chest, just below the collarbone, okay? And then just simply take your head and side bend away. Take a couple of gentle breaths in this position. You can even reinforce that hand with the other hand. And with a delicate neck, I'm not very keen on pulling on the head in any shape or form. You can always very much overdo it and end up in a worse state than when you started. Here we go. Hold the ribs down, okay, and side bend away. A lot of times for these stretches, I like to close my eyes. Just one more way of relaxing. Focusing on your breathing. As you breathe in, you'll notice that those ribs like to come up. And that's one source of dysfunction, is that we forget how to breathe through our abdomen and our diaphragm, and we start breathing throughout our upper neck and chest. You see that, these muscles are really active when we breathe in, especially when we're stressed and our shoulders become elevated. I do have another one for you. This is going to be mobilizing some of the areas above your sinuses. We hold a lot of tension throughout the corrugator muscles here between your eyes. So let's go ahead and take our fingers and let's go up, start at the top of the nose, come up and around and over the eyebrows. You can get a little bit more control by stabilizing yourself with your thumbs on the side of your face. Up and around. Very gentle. Up and around. Up. Again, keeping your jaw just slightly apart. Excellent. We're going to do this little nasal bone wiggle. So you're going to take your little pincers here. Go ahead and grip the top of your nose. And let's just go a little side to side. Side to side. You're resisting that motion. As I push this way, I am resisting that motion. And as I pull with this finger, I am resisting that motion a little bit too. This has a direct link to your sinuses, maybe some sinus discomfort. It's an extra bonus is if you are a little bit congested and you can perform this technique, you may notice that your nose might run. You might get a little bit of relief from that congestion. Also, you can get just below this zygomatic bone here, this little prominence, and do some small circles underneath that area. Very near and dear to your sinuses right there. And a lot of times you can facilitate relieving pressure in those areas. There we go. So I've left some red spots there, so you know I've been effective. I've certainly been there. Sorry about this spot right here. I don't know if you notice it, but I've had pretty much half of my face almost rubbed off by a jiu-jitsu gi. Somebody did that for me. So I don't know if that's noticeable or not, but it feels or felt a lot worse than what it looked like, as do most of these things. Anyways, that's all for now. So that concludes at this point some of my favorite gentle exercises for mobilizing your fascia, mobilizing your joints, moving some of those muscles within the face. I find that to be very helpful. So I hope it's helpful for you. Show up for next time when we attack something new. Don't just be good to yourself, be great to yourself. Home Alone like Macaulay Culkin.